Alrighty, so now we're going to move on to chapter 46, which is drugs for bone and joint disorders. So we've got some objectives highlighted there, which you can look at, and then our two drugs that we've highlighted that you should know. I can't read this from here.
Calcitrol and calcium gluconate.
Okay, so those are the two drugs you want to concentrate on.
Oh, I'll work it. No worries.
Thank you. Yes, I'm going to screw things up.
It's a good thing they can't see us on video.
I know. They'd be laughing at my hair right about now.
Nah.
Okay.
So here are the objectives. We're moving forward.
All right. So the biggest thing to remember is about bones, and as we age, they tend to become a little more brittle, especially for us ladies that tend to be into menopause because of the lack of estrogen in our bodies. Unfortunately, our bones become very brittle. So it's important that we're getting our intake of calcium. And one of the things you're going to notice when you read through the chapter is that vitamin D plays a huge, very, very, very important part in how calcium is absorbed in the body.
Yeah, so your instructors might actually ask you in clinical, why is your patient on medications? And quite often, if they're on calcium, they'll usually be on some form of vitamin D. And we'll talk about why later, but you'll want to have that in your memory banks as a result or an understanding after reading this chapter, so you can answer that question. Yeah.
All right.
All right.
Move right. I see there's a little thumbtack there.
I don't think I have anything in this one.
Okay, you just wanted them to really have a close look.
Just have a close look. Although we do want you to understand the role of the parathyroid when it comes to controlling calcium. So read this section very carefully. And if you're able to explain it to a non-nurse or even draw out the process, that would be wonderful.
Yes, and notice that Professor Mears has circled over there and highlighted that calcium is of utmost importance to being healthy. You need to know the signs and symptoms of hyper and hypocalcemia. I can't stress that enough because of the calcium being so important.
So as you click on these notes, some of them have messages in them for you to read. Calcium is vital to health. Please list what could happen if your calcium was low. You can just list one or two or three side effects, things that you'll see in your assessment or things that could happen to clients. But it does talk about calcium influences neurons or nerves and reflexes, etc. But we're going to keep moving forward. The role of hypocalcemia, it's not a disease. It's usually a sign or a symptom of some other disease or disorder. Anything else we want to add here?
Let me see. Out there, we're talking about hypocalcemia. Notice the signs: nerve and muscle excitability, muscle twitching, tremors, or cramping may be evident. Numbness and tingling, that's a huge one. So, and it talks about increasing the consumption of calcium-rich foods. So, fortified orange juice is a great source of calcium. Also, we have milk. What else? Let me see. Calcium supplements often contain vitamin D. That's to help the calcium to be absorbed.
Yeah. So watch out for signs of hypocalcemia. Signs and symptoms. Assess for any twitching, spasms, paresthesia. Maybe you want to look at what that word means.
Mm-hmm.
That would be an interesting word to look up and understand. Maybe you already know. Wonderful. And we don't expect you to know the normal calcium level. We don't expect you to memorize that. So thank you for watching.
Potassium, yes, but calcium.
Potassium and sugar or glucose, yes, but not calcium. We understand that's...
We'll cheat and look at the lab sheets.
Yeah. So report any signs and symptoms of hypercalcemia, such as drowsiness, lethargy, weakness, headache, anorexia, nausea, vomiting, increased urination, and thirst. Also understand hypocalcemia, which is seizures, spasms, twitching, paresthesias.
So we've now mentioned hyper and hypocalcemia signs and symptoms probably 3 times in the span of 5 minutes, so you know what that means.
Are you giving them big hints?
I'm giving hints.
I also think everyone eats or they consume some sort of nutrition, whether it's through a tube or through their mouth, but it's important to recognize where these good sources of calcium come from. So there'll be a lot of questions. Back up. Sorry.
There's one thing because I brought this to Professor Mears' attention. It says, avoid excessive intake of zinc-rich foods such as nuts, legumes, seed sprouts, and tofu, as zinc decreases calcium absorption. I did not know that. So you see, you read the book, you know.
Learn new things.
That's right.
Yeah, because you think increase your intake of nutrients or zinc and stuff like that.
It says to avoid taking antacids that contain calcium. So as you know, Tums is an antacid that people eat all the time. My husband chews on them like they're candy because he's always got some gastric reflux. So, maybe the patient doesn't realize that they have hypercalcemia, and here they are chewing away on their Tums. So, health teaching, health teaching.
All right. And again, more interventions that we can do and nursing education we may want to provide for our patients. So inform them to recognize and report any palpitations, shortness of breath, instruct the clients to report any difficulty in urination or they may have to measure their intake and output. Very uncommon that this would cause symptoms like this, but I think it's important that they know when you're first starting on a new medication.
Right. And hypercalcemia can lead to kidney stones. So that could be a part of that too.
Yes. And so consume dietary sources of vitamin D. And that obviously vitamin D plays a big role. This is calcitrol right here. So vitamin D is the active form of, calcitrol is the active form of vitamin D, and that helps increase the absorption of calcium. And so you can read these here. Exposure to sunlight 20 minutes a day should supply enough vitamin D to prevent diseases.
And that's extremely important. And research has shown that Windsor-Essex County, our vitamin D levels are lower than a lot of the other places in the world, because when you think of it, our winters, not this winter, but our winters can be long. So my old family doctor was actually part of a research study being done. And she was bringing to my attention one day that women in this area tend to have low vitamin D. So it's really important that you health teach, go outside in the sunshine 20 minutes a day, and that should help for you to meet your vitamin D needs.
Wonderful. All right. And obviously osteoporosis, if you're familiar with that word, wonderful. It's a spongy bone or loss of bone mineral and density. This risk factors include postmenopause, testosterone deficiency, high alcohol intake or caffeine consumption. I think a lot of teenagers consume a lot of pop and caffeine. They don't necessarily consume a lot of milk or dairy products. Anorexia nervosa for obvious reasons. Smoking, physical inactivity, because it's very important that you're stressing and straining the bones to keep them nice and strong. And drugs that lower serum calcium levels, such as anticonvulsants. All right.
All righty.
Over here, participate in weight-bearing activity. That just goes hand in hand with this over here, physical activity.
That's why I do body pump.
And one day I hope I can. I'm not strong enough.
Those
are big muscles. One day I'll be working on a treadmill or beside you or something.
I'm bringing you a pump.
All right. Avoid prolonged periods of immobility. That's my life. Takes special safety precautions to prevent falling and fractures, especially if they do have weak and brittle bones.
Yeah.
So
they say that a lot of these elderly women that, they say they fell and broke a hip, often it's that they broke their hip and then they fell, right? So because of the weakness of the bone, the hip actually breaks and then the patient falls.
Yeah. So again, we can't stress the importance of paying attention to calcium levels. And here we've had immediately report any seizures, muscle spasms, or facial twitching when on this medication. We're not going to have you read this one. You don't have to read that at the moment, and we don't. We're not going to have you read Evista. The medications that you are required to know are calcium gluconate. This is under Blackboard. Calcitrol. We're going to talk about gout and allopurinol and colchicine in the next few minutes. So I'm going to move forward to gout. All right. So anything you want to say on this page other than read these sections that are highlighted for you? Osteoarthritis, rheumatoid arthritis, and gout. These are disorders we want you to be familiar with. So if you have to make cue cards, feel free to do that.
And osteoarthritis, usually we see quite a bit in the elderly. Rheumatoid arthritis is one of those autoimmune disorders where the body starts attacking itself. And then gout is a problem with uric acid. So just know the difference between the different types of arthritises, I guess you could say.
And the cause.
And the causes. Rheumatoid often is treated in different ways, not only anti-inflammatories.
And then we've got over here some suggested non-pharmacotherapies. That means non-drug or non-medication ways to manage pain and arthritis, etc.
Remember, with arthritis, it is an inflammatory process, so we need to take our NSAIDs, our non-steroidal anti-inflammatories. So those are the ones that Tylenol might not work so well. And
pharmacotherapy for gout. So actually, I think I will highlight this. We would like you to be familiar with gout, as it is it's becoming more and more common, I would think. I'm noticing.
That's the one where you get the pain in the big toe.
Yes. bright red, pain,
And it's
etc.
often associated with high intake of red meat, alcohol.
Anything where there's that uric acid breakdown or buildup.
Mm-hmm.
So nursing considerations, the role of the nurse in this anti-gout therapy. Please read these 2 paragraphs carefully. Take medications as exactly as prescribed. These are health teaching. Report side effects such as rash, headache, anorexia. Decrease or eliminate. We should star that.
Yeah.
They should not be consuming alcohol or foods with protein, like red meats and cheeses. That will only cause flare-ups. So maybe you definitely want to know which foods cause flare-ups, because maybe clients need health teaching and education, and that's where you'll come in and you'll play a vital role. I'm going to move forward, and we're on the last page.
Woot woot.
Yes, woot woot. So read the key points of this chapter. All right. There were medications you did not need to read, so be familiar with the ones that you do need to read. This is colchicine. This is one of those medications that we want you to know. So I'm going to highlight it here for you. And we want you to know allopurinol. So where was that? I should back up. Is it colchicine?
No.
Going back one more. And if I don't see it, then I'm going to ask that you look it up in your drug guidebook. Yep, I'm going to ask that you look it up in your drug guidebook. It is a very common medication. Sorry that it's not highlighted here, but allopurinol and colchicine are the 2 medications we'd like you to be familiar with for gout and whatnot for those disorders.
So I guess colchicine would be the one, yeah.
Yep. We can back up and maybe, actually, no, we'll go to the PowerPoints for a second.
That's a good idea.
All right. So again, we talked about how calcium was important for a number of things. It transmits nerve impulses. It prevents muscle spasms. It plays a role in coagulation. Also, the electrical activity of the heart. And you can read these on your own. Hypocalcemia causes, obviously, if we remove part of the thyroid and the parathyroid, that could cause hypocalcemia. Maybe people aren't consuming enough vitamin D or C, and that would lead to hypocalcemia. Keep in mind, these are the signs and symptoms we want you to be familiar with when you're...
Hint, hint, nudge, nudge.
Yes, wink, wink. All right. And did I spell this wrong? Complex, available, complexed. Oops. That was right. Okay. Moving forward, if you don't already know these 2, I would like you to maybe find an image and look that up on the net and find out what Trusow's and Tchaikovsky's signs look like. And again, they are physical signs of hypocalcemia. Vitamin D, it promotes the intestinal absorption of calcium. So that's why we give it. If your calcium's low, we give you vitamin D to promote calcium absorption. It treats also hypoparathyroidism. And calcitrol is the active form of vitamin D. And again, you can get vitamin D with how many minutes of sunlight?
Is it 20?
Oh, you're too nice. I love it. The role of the nurse, after you graduate with calcium supplements, watch out. Can't stress it enough. Once you start giving them calcium, now you have to watch out for hypercalcemia. Here, just like in the book, drowsiness, lethargy, weakness. We're just kind of giving it to you twice. So make sure that you're watching out for hypocalcemia. That's muscle spasms, seizures, paresthesias. I hope you look up that word and find out what it means. Keep in mind that calcium might not be for all patients. People that have had kidney stones as a result of calcium buildup, digitoxicity, any kind of dysrhythmias we're cautious with, or contraindicated depending on what their dysrhythmia is, as well as hypercalcemia. Obviously, if their calcium levels are too high, we wouldn't want to give them calcium. And here's
look, there it is again.
20 minutes of daily sunlight provides enough vitamin D.
And they're LFT. So if you're looking at that going, I don't know what an LFT is, you need to look that up.
Yes, our unapproved abbreviation.
Yes,
Should we tell them?
No, I think we should make them find it.
All right. Or they can ask one another on the
That's
discussion
true,
board.
yes.
And again, rickets.
We don't see a lot of rickets here, but over in some of the European countries, you might be seeing it.
Yes. So osteoporosis, lack of vitamin D or calcium leads to this hollow or empty or spongy bone. quite common after menopause, more common,
More common, yeah.
or low testosterone levels. Signs and symptoms: weak or brittle bones, maybe fractures, etc. And here's the list over here: smoking, low intake of calcium. Things that we do, obviously these are all different types of pharmacotherapy or medications we can prescribe. Moving forward, I'll let you talk about
Oh
this.
yes, here's the HRTs. So at one time, we used to use estrogen because, how I mentioned before, with the postmenopausal, they don't have any estrogen. So what the doctors used to do was put the patients on estrogen in order, or they call it HRT, hormone replacement therapy, to help increase the calcium levels. But unfortunately, after the fact, they found that there was a huge increase in the number of cases of cancer that they were seeing in women: uterine cancer, breast, CA. So HRT is no longer recommended.
Yeah. So once formerly the mainstay, but now we've done through evidence-based practice and
Yes.
research, we know it's not safe. Some tips when you're taking calcium: take medication on an empty stomach and keep it away from meals. Take with a full glass of plain water and remain sitting for about 30 minutes.
Hey, look at that's bolded and also red.
You are good.
Mm.
You are really good for noticing that. Wow.
Yeah. Hint, nudge, nudge.
Wink, wink. All right. And again, this was a medication we didn't expect you to know, so I'm just going to delete it. We do expect you to become familiar with osteoarthritis, rheumatoid arthritis, and gout, so please read up.
I think you're taking those in 221, so you should be familiar with them.
Yes, you'll notice that a lot of our material should overlap or reinforce on a number of occasions material because we want you to understand it at a deeper level. Moving forward, gout is the elevated uric acid called hyperuricemia. Acute gout arthritis is awful. It feels like stabbing knives in your joints. And often clients will complain of a red swollen joint. And this is important for us to assess and think about. Does the client have a history of gout, or maybe this is their first attack and they have a family history? Medications that are commonly used: NSAIDs, non-steroidal anti-inflammatories. Think back to our class on NSAIDs, and there's risks that we warned you about. So those should already be popping to your mind right
And
now.
did you know that gout used to be called the rich man's disease?
I did not.
Yes,
It's
because
wine and meat
wine and red meat, which
and
is
cheese.
expensive.
Yeah.
Yes.
Oh.
See, you learn something new every day. Hanging
Every
out
day.
with me.
So, and then indomethacin is a medication that's commonly used or prescribed for gout.
It's another NSAID.
Yep.
Very strong.
Very strong,
Your
very
gut
powerful.
right up. Yeah.
And so we teach clients to prevent gout attacks by avoiding foods that are high in uric acid, such as meats, legumes, alcoholic beverages such as red wine, beer, or yeast, mushrooms, oatmeal. Increase fluid intake. This is definitely something we want them to do. Increase their fluid intake to 3 or 4 liters per day, provided it's not contraindicated. And then eliminate any kind of alcohol consumption in their diet if possible. If not, definitely decrease it. So
That's it.
all right, we've probably given you a lot
Yep.
to think about, but hopefully this will support your reading of chapter 45 and chapter 46. See you Friday.
Okay, bye.
Bye.